Hi, this is Keats Snideman from realitybasedfitness.com.
And this is Patrick Ward, OptimumSportsPerformance.com. And this is our video companion for our article, It Hurts Right Here. In that article, we talk a little bit about the site and the source of pain and different ideas as far as trigger points and myofascial tension is concerned, and how sometimes just looking at the site of pain, we may be missing the boat as far as helping our clients get better.
Okay, now we're going to go over some of the techniques that it can be used effectively for treating myofascial pain and dysfunction. The first one we're going to go over is called skin rolling. It's a technique that originated in Germany, I believe, and it can be used for pretty much any treatment as long as the skin is not burned or have any kind of an infection. This is basically how it works. You're picking up the skin with the fingers like this and you're rolling it. This can be quite uncomfortable for some people. Now there's a lot of little nerves, little sensory nerves, lymphatic vessels, so you're actually getting quite a bit of neurologic activity just by picking up the skin. Your skin is really your brain's sort of first contact with the environment, so it's not just sort of a outer shell covering like a snake. It really does have a lot of neurologic activity going in it. So this skin rolling is a fantastic way to sort of start the treatment superficially. And it can be pretty gritty, kind of crunchy. You can hold, and you're creating a lot of heat when you're skin rolling. And if it's really painful, and if it's really sort of adhered down to the tissues underneath, it's almost sort of diagnostic as to there being some sort of dysfunction. Not that we know what it is, but that there's something going on. From that, you can do some more dry work, something called myofascial release, where you're actually going to take the skin, put a little bit of pressure, not much, and then you're going to stretch it longitudinally away until you get to what's called the elastic barrier. So you're not actually sliding on the skin, you're just engaging it a little bit until it basically comes to sort of a bind, and you're going to hold that. And these can be held upwards to a few minutes. I personally don't hold them that long because I find it rather boring, but there is a whole school of soft tissue therapy called myofascial release, which really incorporates a lot of these longer holds to get some changes, more of a plastic sort of deformation in the tissues. From there, we can even go into a little bit more dynamic fascial work, something called pin and stretch, active release technique, as created by the chiropractor Dr. Leahy. The myofascial release field has also had pin and stretch or pin and release for probably since like the 60s. So for instance, if Patrick were to extend his wrist here, activating the extensors, I could engage a part of the tendon here, and then he slowly take it into flexion actively. And I'm not moving, oops, that crunched nicely. I'm not moving my thumb pressure, I'm just holding it still while he is moving the tendon in the sheath, or the muscle if I get up higher, underneath my thumb pressure. If I were to do it, that would be called passive release technique. And these usually are going to be done more effectively without putting any kind of a lotion or oil on. From that, we've got stripping techniques where if I added some light oil or like cream, we go into the arm like so, looking for tender spots. If I were to find a tender spot, I could use what's called ischemic compression, where I just hold anywhere from 8 to 20 seconds. I don't want to hold it a lot longer because I'm creating ischemia, so I'm basically shutting off the blood supply to this muscle, which is one of the reasons why it might be in pain in the first place. So I don't want to hold there for too long. For an example for pain site versus source, if Patrick had pain down in his fingers, there's a lot of trigger points up here in the extensors of the arm that I could find that refer pain right down to those fingers. So if I reproduce that pain, that's a good sign that the problem or the dysfunction is not actually in his hand or his fingers, but it's coming from more proximal or above. And if there was a spot that I just wasn't getting a good release from, and the release is sort of a subjective term, we don't really know what it means, but there's basically a decrease in the pain sensation that somebody would feel. So if I wasn't getting a good release, I might try a different angle. I could do a little what's called cross friction on there to try to see if I could get, like right there is a nice little ropey tendon there. And then even if I didn't want to use any cream, with certain muscles you can actually pick them up, like the brachioradialis right here. I can pick this up and sort of pinch it with this pincer grip and do this little sort of chewing motion, or I could just hold, again, 8 to 12, maybe up to 20 seconds, all the way down. And of course, same thing I could do on this side. Forearm's just a nice example for the video to show how these techniques would be done. And lastly, what we'd want to do then is to try to restore normal length to the tissue. So in the case of the extensors, I can have Patrick flex his wrist until he sort of gets to a barrier. He could do it with the fingers open or the fingers closed to get the finger extensors. And then I could come in here and against my resistance tell him to open anywhere from 5 to 8 seconds. Go ahead and open that up, Patrick. So 5, 4, 3, 2, 1, and then he can take a nice breath in and out, and as he exhales, he can actively try to do it. I might give him a little bit of overpressure, not too much, and we could do that for some series. We could also do a active release, active isolated stretching, where he's going to start in an extended position, and then he's just going to flex his wrist, activating the flexors of the forearm to get that reciprocal inhibition of the extensors. And he's only holding for about a 1 to 2 count. And usually that's done anywhere from 8 to 10 reps, 10 just sort of being a nice, easy number to sort of work with. And if we didn't want to do that, we could even just get into some static stretching. But here I might hold a little bit longer, maybe 20, 30, or even 40 seconds, maybe a little longer, just depending on what kind of an effect I'm trying to get. And lastly, if I had done some neurologic assessment of some of the nerves coming down from his neck through his arm, I might have found a component of what's called neurodynamic or neural tension, and then we could go into some what's called nerve flossing techniques where we're trying to mobilize a particular nerve or set of nerves. That's a little bit beyond the scope of this article, but that is also an option.